Good morning, everybody, or afternoon. I guess it's officially afternoon now for some of you. And thank you everyone for having your video turned off. Y'all are automatically muted while you join, just to try to decrease some of the noise. If you get knocked out, don't worry, I will add you back in, and hopefully y'all can see my screen. Just a reminder on some quick housekeeping. This is our third weekly webinar Wednesday. It's been going pretty well so far. Thank you for everyone who's been coming. We appreciate you. Each one's about roughly an hour, and as a reminder, each of these 1 hour webinars will count if you go to 3. That's the same as one of the in-person Master Dairy meetings, just because those are generally 3 hours, so 3 hours of this equals one of those. And I do still need you to fill out the completion form to receive credit. Even if you're here as an agent today, this is the only way I know that you were here, because we've had a lot of people participating, which is amazing. But just please use that as your sign-in sheet. Just follow this link, http://tiny.utk.edu TMDP _ and the word form, and that'll take you straight to
Based on coronavirus.
That check-in form. We're going to post all of these recordings after this meeting for Master Dairy Credit, and that will be on our UT Dairy website page under the Master Dairy tab. And same thing for that one. If you view it later, please just fill out that same form and let me know that you did it, so I can give you credit for it. For any of my agents who want to view this later for in-service training, all you need to do is go to Kate and find the video channel, and I will send out that link later to all of you as well. We have Dr. Linda Tukowski with us on the line today, and she is going to be doing a presentation on mastitis, diagnosis and treatment, going over less is more. She did an excellent job. Was it last year or the year before, Linda, in Sweetwater?
I think it's actually almost the year before now. Time flies, but I have, I've lost all concept of time with this quarantine, so could have been last week.
All the days blur into one another. So without further ado, I will hand it over to her, and I'll stop sharing my screen.
Okay. And I will share mine. It's a whole new world trying to figure out Zoom meetings. All right, so thanks everybody who's joining us. My name is Linda Tukowski. I am the manager of the Dairy Technical Services Veterinarians for Boehringer Ingelheim. I've been with them for about 10 years. Prior to that, I was at Cornell in their mastitis and milk quality lab, and so worked with producers, veterinarians, people in the industry on mastitis and milk quality. So it's a subject that's very near and dear to my heart. So I'll share some information with you today. What we're going to talk about is we're going to talk about kind of the various factors that we can look at that may help predict whether an animal's case of mastitis is going to cure or not. What can we look at with the cow, the bacteria, and the treatment to kind of help us be a little bit more successful. We're going to talk about the difference between short duration and extended treatment protocols. And then we're going to talk a little bit about some culture-based options that some of the dairy farms are employing these days, and that will help us. Our kind of overarching goal is to talk about mastitis treatment and talk about using these treatments judiciously. We have a lot of pressure from consumers and interest from the federal government and the state government with antimicrobial use on dairy farms. And I think there are some things we can do to be proactive in use and really make sure that we can retain the option to use treatments without too much intervention from others. So just to start off a little bit, I want to talk just a little bit about, what antibiotics, how many antibiotics are being used. So some of you may be familiar with the National Animal Health Monitoring System. They do a survey roughly 5 to 7 years of a subset of dairy farms, and they have small farms, medium, large represented, and they just basically interview them about some of their practices, testing they're doing, disease levels. And so they have, over the past 5 to 7 years, each year they do a survey of antibiotic use. And so the first slide is the percentage of operations that are using antibiotics for a particular disease. The blue is 2002 results, orange is 2007, and gray is 2014. And I think you can take away from this slide that most of our dairies are using antibiotics for mastitis treatment. It's probably our biggest category of disease that we're actually treating. If we look at then the percentage of cows that are receiving antibiotics, again, 2002 is blue, 2007 is orange, and 2014 is gray, we can see that mastitis is the reason that if a cow is going to get antibiotics, mastitis is probably the #1 reason they receive this. This does include treatment and dry cow antibiotics as well. So, mastitis is the disease. If we're going to use antibiotics on the dairy farm, it's the one that we're going to treat. And so this use has been a little bit of a concern, or at least an area for how can we do things differently? And so the American Association of Bovine Practitioners, which is a group that most of the cattle veterinarians in the US belong to, have come up with a statement of, how could we promote judicious use of antibiotics? And the #1 is prevention is key. And I think as dairy farmers, you're all thinking about that on a day-to-day basis. You're looking at cow comfort, you're looking at ventilation, you're looking at nutrition, you're looking at milking parlor procedures. And so that should be really our first line of defense against any disease, but particularly against mastitis. Veterinarians should be used with antibiotics should be used with veterinary oversight. So it's a good idea, at least, once a year, to review your protocols with your veterinarian, making sure that they're really targeting the pathogens that you have on your dairy farm, and kind of just an overall evaluation. Other things we talk about is proper selection and use. So targeting the right organism, using the appropriate antibiotic for the right time at the right dose, using labeled products, using narrow spectrum. So, our first line of defense rather than some of our broader spectrum animals. And then really consider, when we should stop treatment of chronic cases. And above all, making sure we have protocols in place, on-farm training, and adequate records. So those are some of the topics we'll weave into this discussion today. So let's talk a little bit about principles of mastitis therapy. Cure is not a random event. There are things we can consider when a cow has mastitis to maybe decide if she's a good candidate for treatment and what are her odds for curing. And so this cure probability is a kind of a combination of various factors. We'll talk a little bit about cow factors. We'll talk about pathogen or bacteria factors. We'll talk a little bit about treatment factors, and how can we maximize our probability of cure by kind of taking the information that we have and using that to help us make treatment decisions. So look at a little bit of cow factors. So one thing is probably the first thing before we actually go and treat that cow with a tube is to consider, her prior mastitis history. How many cases of mastitis has this particular animal had in this quarter? First time mastitis, or is this her 5th time or her 8th time? So really, if we have a cow that's chronic in a quarter, giving her antibiotics for the 9th case of mastitis in that quarter is probably not going to make a difference. So one of the first things I usually talk to people about is just take a moment, go look at her, if you have on-farm data systems in your computer, take a look at her cow card and just look at how many times she's had mastitis. Another thing we can look at is what has her somatic cell count been? Has it been low through this lactation and she suddenly just popped up? Or has she had a high somatic cell count for a number of months, and then all of a sudden she's developed clinical mastitis? We can use that information to help us decide Is she likely to cure? Maybe we need to use longer duration versus short duration treatment. So number one is just look at her mastitis history. Her lactation number is important. Whether she's infected in a hind versus front quarter. We can look at immunity, so genetics, nutrition, stress, vaccination. There are things we can look at there to improve our opportunities for cure. And then certainly anatomy, you know, teat end condition. Bad teat ends are more likely to get reinfected. Udder conformation, certainly if we have an older cow with a dropped udder, you know, she's going to be more likely to get reinfected than a young heifer with a nice tight udder. And then internal fibrosis. So if we have a cow that's had chronic Staph aureus and has, you know, a bag that you can feel a lot of little nodules in, you know, we are not going to be able to effectively treat those ones. So we'll take a look at cure factors. There was a work that was done a number of years ago. So Herman Barkema, who's now based at Western University in Canada, looked at a variety of different mastitis studies that had been published. They looked at treatment of Staph aureus, and each of these studies a little bit different. They looked at whether they were treated in lactation or during the dry period, whether the Staph aureus was subclinical, so high cell count cows, or if they were clinical. And then they looked at these various cow factors to say, if we looked at these cow factors, would they help us make a decision about whether we should treat this cow that has Staph aureus or not? So they looked at parity or lactation number. They looked at days in milk, whether she was infected in the rear versus the hindquarters, her somatic cell count prior to developing or being diagnosed with mastitis, the number of positive samples. So how many times has this animal cultured positive? If she was cultured, what's the bacteria count on those plates? And then the number of quarters. And so if we kind of put all these together, we kind of came up with a nice little rule that for the most successful treatment of Staph aureus, it should be a first or second lactation animal. She shouldn't have too high of a cell count, so somewhere under 1 million at diagnosis. She's only infected in 1/4, and she's not chronically infected. So we can look at this very quickly for, you know, any cow that comes in and say, okay, what are my odds? You know, certainly our first lactation animals are going to be a better bet for treating than a 5th or 6th lactation animal. I always make a joke when I'm doing this in person and say the only thing they didn't add on to this list was if she has a name. Most people are, you know, those pet cows will stay a little bit longer in the herd than some of the other ones. So I think sometimes that's another factor that we haven't ended in. Another researcher, Ruth Zadok's, actually looked at the same factors for strep uberis. So this is an environmental pathogen. Staph aureus, remember, is a contagious pathogen that is spread cow to cow at milking time. Strep uberis we can find anywhere in the environment, and so it gains entrance through the teat end and is usually a numbers game. The more bacteria we present to that teat end from the environment, the more likely she is to get infected. So this was a Dutch study, and it was actually one where they were starting to look at Staph aureus, and so they were doing kind of a prevalence and incidence study over time. So all quarters of all cows were sampled every 3 weeks in 3 herds for 18 months. Bulk tanks somatic cell count for these herds range between 200 and 300,000. They were small herds because they were in the Netherlands, but they found the same risk factors for strep uberis. The ones that were less likely to cure would be the ones that were higher lactation number, ones that were in peak lactation if they'd had previous clinical mastitis in that quarter, or they had an increased cell count. So again, we can kind of look at that cow and her kind of predict whether she's going to be responsive or not just by looking at some of these cow parameters. We also know that immune status in certain diseases may have an impact on severity or risk for mastitis. So a researcher in Canada actually looked at the relationship between ketosis and mastitis severity. And so beta hydroxybutyric acid is a ketone body that we measure in the bloodstream to decide if a cow is ketotic or much. And as BHBA levels rise, we found that those cows are the mastitis severity, if they have E. coli, was more severe. So we may want to think about if we've got a cow that's a weak in milk that has severe ketosis. You know, most of the time E. coli they'll get recover on their own, but that early lactation ketotic cow may need a little bit of antibiotic assist from us. So certainly nutrition has an impact. So we'll segue now a little bit over to pathogen factors. Bacteria are all different, and their genetic makeup and whether they're a gram-positive or gram-negative gives them different characteristics, and so they differ by invasiveness. So if we talk about Staph aureus, those are the ones that create those micro abscesses. They get deep into tissue. They become very hard to cure. So they're like the poster child for an invasive mastitis bacteria, where if we look at E. coli mostly lives on the surface of the ducts. It's not invasive. It's just a very superficial bacteria. So they differ in their ability to invade tissue. They differ in their response to antibiotics, and particularly to the limited number of antibiotics that we have available to treat mastitis. They differ in how that cow will respond to that bacteria and her own innate killing ability. And there are some pathogens that we know will not respond at all, no matter how many antibiotics we put at them. Yeast, Proteus is a gram-negative, Serratia, Pasteurella. So having an understanding of what bacteria is responsible for that mastitis case, or at least the most likely one on your dairy, will give us an idea of a treatment decision to treat or not to treat, or maybe even duration of treatment. And if you were to look, if you can see my cursor, if we look over here to the left, most of these are gram-positives. We have some E. coli. Once we leave Klebsiella to the right side of the graph, none of those bacteria really have great response to antibiotics, or to the right of the graph, I think. Can't remember what I said. All right. And so we can, you know, just kind of to underscore this a little bit, by having a mastitis diagnosis, we can make a decision to treat or not to treat. So if we look at E. coli, most E. coli cases, and this was work that was done, they looked at a variety of mastitis cases and then looked at whether it was an isolated case, if it was an acute case that then became chronic, so a hot mastitis then became chronic, kind of a chronic low grade, and then subclinical means that the cow had a positive bacteria culture but didn't show any symptoms. So if we look at E. coli, most of our E. colis are one and done. The cow gets an infection, she mounts an immune response, and she will get rid of it. And so that will, if you'll remember that, that'll go into a little bit into some of our treatment protocols as we go further. E. coli is a gram-negative, so it has a different cell wall than some of the others. If we go to the next group, which are Staph aureus, Strep dysgalactia, Strep uberis, those are gram-positive organisms. They have a thicker cell wall. We usually need antibiotics to penetrate those cell walls. They do not alert the immune system as quickly as E. coli was, and so most of our Staph aureus, Strep dysgalactia, Strep uberis, if they go untreated, they may become chronic. They also tend to have a long subclinical stage before we actually see clinical mastitis. So just remember a little bit between the E. coli and the gram-positives, the Streps and the Staphs. So this is, knowing these differences in these pathogens, it's really kind of introduced this question in the mastitis world regarding E. coli mastitis is, you know, are intramammary antibiotics necessary to treat these? And so this was some work that was done by Tina van Verven in Belgium. And we actually look at this graph, I'm going to orient you a little bit. So these were animals that were challenged in a quarter with E. coli. And then this researcher then took sequential milk samples and measured. The red is the number of bacteria that they found. The yellow is the somatic cell count. And so this is hours on the bottom graph. And then on the y-axis, we have the log of the number of bacteria or the somatic cell count. And so let's just focus on the red line to start with. This is the bacteria that she was recovering from these sequential samples of these quarters. And so you can see they were infected at time 0. Bacteria grow logarithmically, so they started to each grow right at about maybe a couple hours after challenge. We see a big increase in the bacterial numbers, and what we see is this is the somatic cell count over here. With the somatic cell count, we start to see it stays pretty flat. It's running at about 200,000. And as those bacteria start to grow, it sends an alert out to that cow. And then all of a sudden, we see a massive increase in somatic cell count in these quarters. Somatic cells are there to kill and engulf bacteria. So what we see is we get out to about 20 hours after the first day, pretty much after infusion. Those somatic cells were then effective in stopping that bacterial growth and then dropping the bacterial counts. I'm trying to run my cursor on 2 slides. So they were effective at killing the bacterial numbers while we get out to 3 days after challenge were basically gone. If we look at the somatic cell count, somatic cells are there to kind of clean up the dead bacteria, clean up the cellular debris in there. So the somatic cell count will take a little bit longer to decrease compared to the bacterial numbers. These animals were not treated. We were just following the natural course of disease in this. So you can see the cow is very effective at being able to eliminate most E. coli bacteria or infections by herself. Where we would probably see clinical signs in this is we probably wouldn't start to see clinical signs out till about 24 or 48 hours once these bacteria are really, the somatic cell count are really doing their job. So by the time we start to see clinical signs, that cow is already doing her job. She's killing those bacteria. If we give, antibiotics later on in this, we're not really going to change the course of the disease. So this research was really some of the beginning research that helped us kind of question of, do we have efficacy against gram-negative pathogens or E. coli with intramammary antibiotics? And this is the start of kind of saying that, maybe we don't need to treat these E. colis with antibiotics as long as the cow is healthy. Certainly if she's a sick cow, she's feverish, she's off feed, those may be the ones that need some antibiotic support with injectable antibiotics. But for the most part, with E. coli mastitis, we find that intramammary antibiotics do nothing to change the course of that disease. That's about when we would see so the cow's immune system, kind of our little take home here, is much better at killing E. coli than gram-positive pathogens. So if we look at, and so this question has been, what about gram-positives? And so there's been some prior research that was done. In California, they looked at the difference in clinical cure. So that's not doing anything with bacterial cultures, but does that milk go back to normal? They looked at the difference between treatment with antibiotics or just oxytocin, and they found that the inflammation went away at the same time, but there was a difference in relapse rates for the gram-positive cases that got treated. So clinical signs went away. If they were gram-negatives, those cows stayed fine, but for those animals that were infected with strep or staph, they were more likely to relapse in the oxytocin treated arm than in the antibiotic treated arm. So that gave us some indication that, antibiotics are necessary for gram-positives. There was a Colorado dairy a number of years ago that implemented a no antibiotic therapy approach for mastitis and lactation, things went along great for a year or so, and then all of a sudden, they noticed bulk milk somatic cell count was creeping up, and they ended up with an outbreak of strep uterus. So once they started to reinstitute lactation therapy for their gram positives, bulk milk somatic cell count went down and things got a lot better. And then if we even just look at our clinical trials, all of our clinical registration trials include a non-treated control. And so in those trials, we can always demonstrate a positive effect for antibiotic treatment of gram-positive pathogens, but not as often for those gram negatives. So, are intramammary antibiotic treatments necessary? In the case of gram-positive infections, yes. In the case of gram-negative infections, maybe not. And so if we were to look at, if I took 100 cows on 100 dairies and cultured all their mastitis cases, we usually see a pretty consistent distribution of no growths, gram negatives, and gram positives. And so this is actually 4 different research studies, and I broke down their mastitis pathogens by category. So yellow would be other, so that might be yeast or contaminated samples. Gray is the no growth. Orange is gram negative, so our E. coli's and our Klebsiellas, and blue is the gram positives. And I think one of the first things you can kind of appreciate is, of all those mastitis cases that we culture, roughly about 1/3 of them are no growths, and no growths, I know it's frustrating when you get a culture result back and it's negative, but really that's actually a good result. Cows that we get a no growth on, those are likely cows that have cured themselves. And I'll put a little asterisk in that and saying as long as we don't have a mycoplasma problem on our farm. But no growths show that that cow was effective in eliminating an infection, just like we eliminate our common colds and things like that very often without antibiotics. If we look at the gram negatives in the orange, that usually translates to be about another 1/3. And as we talked about in those previous slides, with E. coli, as long as those cows are not sick, the cows are likely to eliminate those bacteria themselves. And then we're left with maybe the last 1/3 that are gram positives. And so if we really start to take a step back and think about, how many cases really need intramammary therapy? If there's no growth, there's no bacteria there. So if we start to do some culture-based therapy or so, just doing that, we can eliminate maybe 1/3 of our antibiotic treatments. If we adopt a policy of not treating gram negatives, we may eliminate another 1/3 of mastitis treatments, and then we get to, the gram positives. So really, when we look at it, only about 1/3 of our cases will actually benefit from antibiotic therapy. So we'll move on to duration of therapy. So we've we've talked a little bit about it. What cows should we treat? What pathogens should we treat? And so the next biggest thought in the industry is, how long should we treat? Should we treat 1 day, 2 days, 5 days, 8 days? And so there's been some recent research we'll show with you, but we'll talk a little bit about duration of treatment. So things we need to consider is the invasiveness of pathogens. So if we have a very invasive Staph aureus, maybe a cow that's had a chronic somatic cell count for a while, if it's a highly invasive pathogen, we may want to go a little bit longer with treatment. What antibiotic are we using? Some are very effective at shorter duration, some require a little bit more. What's the risk? The longer we treat, every time we put a tube in a cow, we run the risk of that cow accidentally getting milked into the tank and having a positive residue. So we talk about that kind of risk. Every time we put a tube in a quarter, if we're not incredibly scrupulous with our administration technique, we actually run the risk of potentially giving her a microbe that wasn't the cause of the mastitis. And then we think about the economic cost versus benefit. Short duration treatment may allow me to put that cow back into the saleable milk tank a little bit sooner? You know, should I treat her another day to get another maybe 5% increase in cure? So, you know, lots of things to consider when we're trying to decide how long we should treat these animals. So extended therapy became popular when I was working at QMPS in the early 2000s. And, you know, the question is how did it become the norm? And I think one of the things we need to talk about is infection versus inflammation. And I usually make this, you know, when I'm doing this live, this is an audience participation quiz. So I'm just going to have you think in your heads for a minute as you look at these pictures. If we look at a red inflamed udder, is that infection or inflammation? So it's actually inflammation, right? So we have the cardinal signs of inflammation are swelling, pain, redness, and heat. And so a red inflamed udder is just the cow's reaction to a bacterial infection. Could be an inflammation if she had gotten kicked by another cow. But when we see a swollen, inflamed udder, it doesn't tell us there's an infection there. It just tells us there's a reaction to something. We look at a CMT paddle. Is that telling us if there's an infection there or inflammation? So CMT measures white blood cells. White blood cells are the inflammatory response to a pathogen or maybe a chemical. Doesn't tell us that there's bacteria there, but it's telling us that the cow had a response to something. And if it's in the quarter, most likely it was an infection, but we don't know where she is on kind of that bacterial growth curve. She may have been very, very successful in eliminating her bacteria, and we're just seeing a positive CMT for, you know, another week or two after the infection has been resolved. How about strippings in a cup? Is that infection or inflammation? Again, strippings in a cup are inflammatory products. They're white blood cells. They're dead bacteria. They're not necessarily, we can't determine that there's actually an active infection there. We're just seeing the body's response to something. Strippings on the deck. Again, you know, I'll say if this is infection or inflammation. By this time, people have kind of gotten the gist and they're thinking inflammation. That's actually teeth sealant. But you know, when we're using some of the white teeth sealants, we do get those confused with inflammation and mastitis. And the last one is a bacterial culture plate. All those little kind of yellowish dots on there are bacterial colonies that are growing. If you know, think for a quick second, is that infection or inflammation? That's infection. The only way we know that there is an active infection there is by doing a milk culture. So that's kind of our definitive diagnosis of infection. Now, inflammation, you know, when we start to see clinical signs, usually lasts on average about 4.5 days, maybe 3 to 6. And even if that bacteria is cured or not cured, milk goes back to normal. What we've become conditioned to do is to treat until milk goes back to normal, which is what we call clinical cure. We may kill off those bacteria with the first treatment or two, and then it takes time for that cow's quarter to go back to normal, for the redness to go away, for the clots to go away. But we've become used to just kind of putting a tube into that quarter until milk goes back to normal. And about the time we get that 5th or 6th tube, milk goes back to normal. And we think, oh, must have done it. That last tube really helped. What I want you to realize is that, you know, and even if you think back to that E. coli kind of thing, bacterial cure may be achieved in 1 to 2 days, but it always takes about 3 to 6 days to resolve that inflammation. And I'm going to show, we'll start next with some data of a study that was done by Cornell that compared a short duration treatment in the world of mastitis gurus is usually defined as 3 days or less. And there have been a number of studies that have been done in the past 10 years that have shown that short duration protocols has equal efficacy to extended therapy. And those are a few of the studies kind of listed there. And if we're thinking about short duration therapy, and I usually ask this question out there is, what's your biggest cost in mastitis treatment? It's not the tubes, it's not the labor, it's the milk that's going down the drain from the hospital pen. So if we can use shorter duration treatment, if it's effective and we can get those, cows back into the saleable milking string better, they're going to spend less time in the hospital pen. We'll save time, we'll save milk, and we'll save money. We'll use fewer antibiotics, and that's kind of our goal. Particularly when we're using fewer antibiotics, it kind of really helps strengthens the dairy industry's reputation with consumers. If we're telling them, we're using antibiotics only when necessary and for the shortest amount of time possible, I think it's a gold star for the dairy industry. So this was a study that was done at Cornell. And so they compared 2 commercial intramammary antibiotics for the treatment of non-severe clinical mastitis. So these were cows that only had mild or moderate mastitis. So they either just had abnormal milk or they had abnormal milk and an inflamed quarter. If the cows were sick in this trial, off feed, feverish, dehydrated, those cows were not enrolled in this trial. So this was done by Dr. Amy Vasquez when she was at Cornell. And in full disclosure, I will say BI gave monetary support to this trial to have it done, although it was all done, protocol design and analysis was all done by Cornell. So in this study, we were looking at comparing a 3-day, 1 tube given every 24 hours for 3 treatments of Polymast, which is heticillin potassium. It's like a penicillin-related drug, to a 5-day, every 24-hour interval treatment of Spectromast LC, which is once a day for 5 days. So that was our objective, was to compare those 2. For a farm to be considered to be enrolled in this trial, they had to have at least 500 cows. They wanted to kind of get through the study relatively quickly. The farms needed to participate in DHIA testing with milk weights and somatic cell count testing. History of streptococcal mastitis, because they wanted to evaluate Polymast against efficacy against streps. This is the timeline of events for that trial. So farm personnel, usually the herdsman, was trained to the protocol. And so if a cow was identified with mild or moderate mastitis, they took a sample of milk for culture, and then they opened an envelope that said randomize that cow to either one of the 2 treatments that were being done. They were randomized either into the Polymast arm or into the Spectromast arm. So both treatments were done, at the same time on those dairies. And so if we look at here, and what they did, blue is the clinical score. So they took a sample for culture, and then they had a little algorithm for the clinical signs to kind of give a numerical value to what the milk and quarter looked like. Was it bloody? Was it clotted? Was it watery? So they had a little, was the quarter swollen? Was it hot? Was it inflamed? Excuse me. And so they did a clinical score. As soon as they took that bacterial sample for culture, and then they did a clinical score again on days 2, 3, 4, and 5. The Polymast animals were treated initially, then the next day and the next, and then the Spectromast animals were treated once a day for 5 days. Excuse me. Okay, so they were treated 14 days after they were enrolled in the trial. They came back for a culture again and another clinical score. Another sample was taken at 21 days for culture and a clinical score. And then these animals were followed for 60 days for production, somatic cell count, culling, or death. I apologize. I have some allergies. I don't have COVID. So these are kind of a breakdown of the culture results. If we look at here, if I were to draw a line right about here, these would be the gram-positive organisms. These would be the gram-negatives. I think what we can appreciate here, and this is count, not percentage, that, you know, many of these samples were no growth, which would be these lines here. Whether you were in the polymast or the spectromast, most of them were no growth. And then we had the gram-positive streps and staphs, we had the gram-negatives, and then we had a smattering of some of those other organisms that we don't expect to respond. But pretty much kind of an equal distribution of pathogens between the two treatments. If we look at this study just by, if I kind of summed all those up and then looked at the percentage by gram staining status, you know, 37% of the organisms identified were gram positives, 28% were gram negatives, 28% were no growth, and 7% were others. So, you know, all these farms kind of followed my rule before, and we ended up about a third, and a third. We look at bacteriologic cure, and so what the bacteriologic cure was, if a bacteria was identified in that first sample, it had to be gone from both of the follow-up samples. So, and if it was there, wasn't in the first follow-up, it was in the second, that was a treatment failure. It was not a bacteriologic cure. So of all those samples that we took, we had 353 cases that had a bacteria to start with, and then was, you know, and then we had samples afterwards. So 164 cases were treated with polymast, 189 were treated with spectromast. Overall bacteriologic cure, if we kind of lump both treatments and all samples together, was 71%, and that's pretty typical for what we see for any of our mastitis treatments, is about a 71% cure rate. If we look at the polymast, there was 68% cure rate. Spectromast, there was 73%. These were not statistically different, so there was no difference overall with bacteriologic cure. If we look at clinical cure, so we had these cows, and we could include the no growths in this one. So we were just looking at time to resolution of the inflammation. So, you know, milk goes back to normal, quarter goes back to normal. So because we could include the no growths in this one, we had 572 cows to analyze. 268 were in the polymast arm, 204 were in spectromast. And remember, they were doing clinical scores every single day. So there was a higher percentage of polymast cures, that cows that experienced a clinical cures in less than 4 days. Spectromast ones tended to be a little longer, but we think that's really might have been some observer bias. So, you know, ultimately what we found is that there was no difference in clinical cure when we followed these cows out all through 21 days. So milk and quarters went back to normal pretty much at the same time in both these groups. Other things they looked at, they didn't find any differences in milk production. So no differences there with shorter duration versus longer duration. No difference in somatic cell count. No difference in culling by 30 days or culling at 60 days, and no difference in relapses. So the only difference that they found in this trial was that cows that were in the polymast arm had fewer days in the hospital pen than the ones that were in the extended therapy treatment. So, you know, and when we think about that, that potentially translates into money for us. So ultimately, let me go back a little bit, you know, so if we think about milk production, you know, if we're looking at cows leaving the hospital at 6 days versus 8 days, we've got 2 days of milk production ahead in those animals that were treated in the short duration treatment. A similar trial was done by Cornell, and again sponsored by BI, a few years ahead of this, where they looked at label dose of today versus 5 days of spectromast. And again, there was no difference in cure rates, particularly for our gram positives. the biggest difference in that study as well was that cows in shorter duration will spend fewer days in the hospital pen, and we will also, you know, if we think about using 2 or 3 tubes versus 5 tubes, we've reduced some of our tube cost, and we're practicing maybe some better use of antibiotics, a little bit more thoughtful on our farms. We have to show you the residue warning, so you have that there. And now we're going to talk a little bit about culture-based treatment. I'm going to go through this a little bit quickly just to kind of talk about, we have a lot of farms out here that are using some on-farm culture rather than waiting for results to come back from a laboratory or their veterinarian. There are some pretty simple diagnostics that are available now to be able to make treatment and pathogen decisions right at the dairy. And so when we're treating clinical mastitis, we have several options. We can only decide to treat only severe mastitis. We could treat all our clinical mastitis cases exactly the same, or we could use culture and make a treatment decision after 24 hours. So we could wait to institute treatment and then only treat those gram-positives after 24 hours, or we could start treatment and then maybe change after 24 hours. You know, so the goals of culture are to identify if there's an infection there or not, have a kind of 30,000-foot view of what type of bacteria is causing the infection, and then help us make an informed treatment decision to treat with, you know, short, long, or no treatment at all. So, you know, we have on-farm culture. It's not 100% accurate. We've kind of made a simple system. It's about 80% accurate for gram-positive and gram-negatives. One of the things we need to realize is it won't identify 100% of the mastitis bacteria we have out there. Mycoplasma and Pasteurella will not grow on these easy culture systems, and then it doesn't allow us to kind of drill down into what type of gram-positive it might be. So, but for giving us an idea of gram-positive, gram-negative, or no growth, they are pretty handy. So this is the Minnesota Easy Culture Plate System. They have two different types of media. You plate some milk here, and then you plate some milk here from your case. The red side grows our gram-positives, our pink side grows our gram-negatives, and if nothing grows on either side, it's a no growth. If it grows on both sides, we call it contamination. So growth on the red, it's gram-positive. Growth on pink, it's gram-negative. And so we can just use these simple diagnostics to help us with it. So, you know, so I talked about a third, a third, a third. A third of these we would normally expect to be no growth, and if we get a no growth, that's actually good. The cow has self-cured. And so using antibiotics in those quarters really will not have any impact to our treatment success. A third of them are gram-negative, so most of those mild and moderates will self-cure. If we treat those, we're probably adding cost and residue risk without a real gain in treatment, in cure advantage. And if we start treating our gram-positives, most of those will respond to treatment. Our decision then becomes whether we do short duration versus extended. And then we have those other pathogens out there where we have no effective intramammary treatment, but that should be a short kind of, you know, a small percentage of the cases. Now I realize not everybody can culture. But, you know, so at that point, you know, let's think about targeting our treatment towards those gram-positives. Maybe use a short duration product that's good for gram-positives, realizing that maybe 60% of those cases, if we're not culturing, really don't need treatment. So I'm going to just go finish up with a pathogen treatment decision trial for clinical mastitis. This was, again, done by the Cornell group. And what they wanted to do, there was and I'll give a little history on this farm, but compare blanket intramammary treatment. Blanket means every case of clinical mastitis gets treated exactly the same, to pathogen-based selective treatment, where we're using culture to help us make treatment decisions. So this is a large dairy located relatively close to Cornell. Cornell, the mastitis lab there, has a unique service where they send a courier out to farms every single day, pick up samples. Samples come back by noon to the laboratory. They get plated, and then results are sent out 24 hours later, either into their dairy comp, phone, fax, any way they want to get their results. And so the idea to do that was to, wait 24 hours to get your culture results to make treatment decisions. This 3,500 cow dairy had actually been culturing every clinical mastitis for 10 years, but they had never used those samples ever to make a treatment decision. Had a new director come into QMPS, and he said, this is a great revenue stream for us, but at $6 a pop at a 30% mastitis rate, it's not a great economic decision for you. You should make a decision about whether we're going to use these culture results or just quit culturing. They weren't ready to quit culturing, so he had a new grad student on board, and they decided to set up a trial. So this trial ran from roughly about 6 months. Again, only mild or moderate mastitis cases were sampled or enrolled in this trial, and they were participating in this 24-hour kind of culture service. And so there were 2 treatment groups in this trial. Blanket therapy received, and this was the farm standard protocol. They got 1 tube of Spectrum-Mass daily for 5 days. The other arm of the trial, and that Spectrum-Mass treatment started as soon as that sample was taken for culture. The pathogen-based sample went in cows that got randomized into that arm. The sample went in, was cultured. Those cows hung out in the hospital pen for a day until results came back. If they were gram-positive, so they were streps or staphs, environmental ones, those cows then received 1 tube of Today, and it was repeated at 12 hours. If they were a gram-negative or a no-growth, they did not get treated. If they were a mycoplasma or a Staph aureus, they were culled. And so what they looked at is clinical cure, so days to return to normal milk, total days out of the tank, next test linear score, next test milk production, culling by 30 or 60 days. So if those, if cows in the pathogen, was there a risk for cows that weren't treated to leave the herd sooner than in the arm that everybody got treated? And then they looked at relapses. So just to kind of look at the results, they had almost 500 clinical mastitis cases. Pathogen-based, those were the ones that got once-a-day treatment with blanket treatment once a day with Spectrum-Mass. Pathogen-based, only gram-positives were treated. Roughly about the same number of cases in each one. Percent treated, so in the pathogen-based, 100%. In the pathogen-based, only 34% of those cows got treated. Those clinical mastitis cases got treated. So we saved roughly 2/3 of our antibiotics if we were using pathogen-based treatment. Days to clinical cure, there was no difference. Next test day milk production, there was no difference. Next day somatic cell, no difference. No difference in culling by 30 or 60 days. Again, the only difference that they were able to determine here was days out of the tank, roughly a 2-day difference in days out of the tank. And then they also looked at relapses, and there was no difference in relapses between the group. They did a little partial budget analysis. So these were the assumptions. They ran it at a number of different milk prices. Spectrum-Mass, these were roughly the market cost for the tubes at that time. They added in labor cost. The culture cost was $6. This was in a much better time of our lives when cows were, we were getting $20 per hundredweight. But they also ran this at a $12 milk price and a $24 milk price. And then they based this kind of model on 5% monthly clinical mastitis rate per 1,000 cows. And so if we look at kind of the outcomes here, the cost for a cow to be enrolled in the blanket was $25.25. In the pathogen-based, if they got treated, it was $15.95. If they did not get treated, it was $7.25. So that was roughly the cost of the culture and the labor. I think what we can appreciate is, if we look at the cost of the milk we've dumped, blanket, it was about $106. If we look at, treated with the 2-tube treatment, it was $84. If we look at milk dump, and that was just dumping milk until milk went back to normal, was about $60. So if we look at, the difference between the blanket and the pathogen, we're looking at a difference savings if we do a pathogen-based protocol of about $54 per case. If we look at, on that 5% clinical mastitis rate per 1,000 cows, we look at a savings over time if we adopt a pathogen-based protocol of roughly about $32,000. So it was enough to convince this dairy and a few others that pathogen-based treatment was the way to go for them. So I am almost up to my time. There's our little disclaimer there for our product. So from this trial, the pathogen protocol, only 60% of the clinical mastitis cows were not treated. In the pathogen-based protocol, they spent 2 fewer days in the hospital pen, and it increased cash flow on that dairy by about $30,000 without any negative effect on milk production, somatic cell, culling, or recurrence. So just to kind of give you a couple take-home thoughts today, mild and moderate mastitis cases are rarely emergencies. So it gives us the time to look at that cow card, potentially do a culture, think about our treatment, and make some decisions rather than just immediately treating. No treatment is certainly an option in some cases. And certainly if we have no growths or E. coli's, we've made the, I hope I made the case that, antibiotic treatment may not get us any further ahead. And that, mastitis therapy and taking a judicious approach to antibiotic use, is going to be good for our pocketbook and kind of good for our, how the public perceives us, and helps us be a little bit more responsible. So I will end at that point. I just wanted to point out here, I don't know why this came out so wonky, but
It makes us remember Todd.
yeah, it looked good on my slide, but anyway, Todd Jennings is the the local Beringer Ingelheim rep in the Sweetwater area. Stacy Turner is a little over farther west in Tennessee, so I don't know where y'all have dialed in from. But he would be happy to answer any questions, or if you need any information, as would I. He can certainly push it to me as well. So I would like to thank everybody for their participation and their listening. If anybody has questions, I have no place to go in my office, so I'm a sitting duck. So.
Well, I do have a multi-part question for you, Linda. Thank you for that presentation and for taking time out to do this today. And while she's answering this one, guys, if y'all have any waiting in the wings, just please feel free to throw them in the chat or unmute, and I will see you in the queue, and I'll call on you when we have a second. So the first part of this question is, in the farms you're working with, do you have any antimicrobial resistance issues?
To date, we have not, on the farms, have not demonstrated any antimicrobial resistance issues. I think animal agriculture gets a bad rap, and people are quick to point fingers. So we have not, as far as mastitis treatment, have not seen a lot of issues with the antimicrobial resistance. When we talk about bovine respiratory disease and pneumonia, we see more on that side. But as far as mastitis, no, we don't. However, I think it's always good to be cognizant of it and make sure that, I don't think we're contributing, but let's not contribute if we can. So there's answer to part one.
So part two is probably a little bit more involved than we can get into today, but maybe just answer it broadly. Which antibiotics are commonly used in mastitis as far as treatment and prevention?
Okay, and
That's
actually
a long list. So
that's a lot.
we
It's
can go through
and
them all.
actually you can pretty much, you can actually lump it down to two groups. Our biggest group are the beta lactams, right? So that'd be anything that's our ampicillin, amoxicillin, cefepime, which is today ceftiofur, which is Spectromaster, Exceed, or Naxel. Most of them are beta lactams for mastitis. The outlier there is Pursue, or it's perlamycin. It's in a different category. They were actually in that NOM study, and I kind of deleted that slide out of time, but the vast majority of treatments on, I think 60% or greater in our dairy cows is actually third generation cephalosporins, and that's starting to get a little bit more scrutiny because the third generation cephalosporins have some corollaries that are used commonly in human medicine. In the European Union, many of the countries, the Netherlands, Belgium, Germany, have banned the use of third generation cephalosporins. So there is some concern amongst other countries. We are not at that point, but that is probably the biggest category of antibiotic that's used.
And then the last question for that multi-part was, what do you do with milk from mastitic cows?
In an ideal world, we dump it down the drain. A lot of people will pasteurize it and use it to feed it to calves. It's probably not our best quality milk, so not making it a great practice, but we certainly can do it. There is some concern, and particularly depending on type of antibiotic we're using, is what impact that mastitic milk with bacteria, with antibiotics in it, have on the GI flora in calves. So, at times of low milk price like now, where we're in my area, we're dumping a lot of milk, probably the best thing we can do is use a good quality bulk milk to feed our calves. But some of it will get fed back to calves as mastitic milk.
Thank you.
You're welcome.
We have one going back to the E. coli portion. If you don't give an intramammary, do you still give the polyflex injections?
For mild and moderate mastitis, I would say no. In a cow that's sick, we have demonstrated that injectable antibiotics are of benefit to those animals. Usually because it's not so much the mastitis bacteria we're treating, it is the septicemia. With severe cows, those cows are more likely to have bacteria in their bloodstream that usually actually comes from shock and a leaky gut. So we know injectable antibiotics like Polyflex are used when we have a sick cow. Mild or moderate mastitis, none of the antibiotics we actually have labeled for dairy cows get into the udder at high enough levels to be efficacious. So I hope that answered the question. So no, if anything, with a mild or moderate mastitis, if you want to give them some anti-inflammatories, that's probably good. But most of them should resolve, within a couple of days.
Thank you. Any more questions for Dr. Tukofsky while we still have her on the call?
This is Celeste Blackburn. I have one more question.
Sure.
On the Spectromast, we normally only do 3 days. Is 5 days the recommended procedure? I thought it was only 3.
They have a flexible label, so it's anywhere between 2 and 8 days. If you looked at some of and so we don't really have any data for 3 days of Spectromast. If you look at some of the material that came out when the product was released, they compared no treatment versus 2 days versus 5 days versus 8 days. Cure rates for no treatment for the streps they were looking at was low cure rates. 2 days was better than no treatment. 5 days was better than 2 days. 8 days was better than 2 days, but 5 and 8 days was not different. So I think that's why, you know,
Okay.
the 5 days is probably why we came how we ended up, you know, landing there most commonly.
Okay. Thank you.
You're welcome.
So Linda, earlier you'd mentioned the white teat sealant is something that would show up when you stripped. Do you have any info you'd want to share with us about possibly different colored teat sealants
Oh, sure.
that you might produce?
That was like a softball there. Yeah. So for those of you who are not familiar, Boehringer Ingelheim launched a teat sealant roughly about 2 years ago. A lot of farmer research and farmer surveys went into this product. It is and one of the things that, you know, as we thought to bring this to market, we asked producers what they liked and what they didn't like. And so the lockout product actually, it's lockout, like, you know, lock the bacteria out. We changed the syringe a little bit. It's a much smaller syringe. It's a little bit more ergonomic, particularly if you have a large dairy and you're doing big dry off days. You can get some kind of repetitive injury from doing things like that. So it's a little bit more ergonomic. It does not have an air bubble in it. That was one of the concerns the producers had before, is they didn't like the air bubble. And then we also made it a blue color so that you could distinguish teat sealant from mastitis flakes. It also probably gives you a little bit better efficacy on being able to strip out or know you've stripped it all out. So it's blue just mostly to distinguish it from milk and mastitis flakes. Thank you.
Thank you. Any more questions for Dr. Tukofsky? Or me?
Yeah. Well, I certainly appreciate the opportunity today. You know, it's nice to kind of get back into the real world rather than just kind of sitting at my desk by myself all day. So it was exciting for me. Yeah, like, thank you. I appreciate it.
As a reminder, please fill out the completion form to receive credit. It is the only way I can count you because we have people that pop in and out for most of the day. And as a kind of preview for what's happening next week, for any of you who have Spanish-speaking employees that you would like to give them the opportunity to learn a little bit more about COVID-19 and a little bit more about how to protect themselves and keep them from spreading it to each other or anyone else, Jorge Delgado from Alltech will be on with us next Wednesday doing a Spanish-only webinar. I will be on to just kind of listen in the background and moderate. My Spanish isn't all that great, so I don't know how much of it I will be able to follow. But for any of you with Spanish-speaking employees, I think it's going to be a really good opportunity. That will still count for Master Dairy credit for those of you producers on the line. Just fill out the recording afterwards, fill out the form afterwards. You don't have to have your employees do that. You can just click that they were there and we'll get that counted for you. The first one in May, Cass Ngawa is going to be with us from PC Dart DRMS, and he's going to be going over some tips and tricks of how to use PC Dart, whether that is linking multiple events or using the tracker feature to do some of the things that Dr. Tukofsky talked about earlier in her presentation as far as the record keeping side. He's also going to be able to answer any of your questions about DART while we're online. The next week after that, I'll be going over dairy cattle housing and maybe some different management strategies we could use during lockdown. And the week after that, we have our friends from the Ag Econ department talking about the Coronavirus Food Assistance Program. I'm sure many of you have been following that closely, and we are following it right along with you. So we don't have much more information than you all do right at this point, but hopefully by that third week of May, we'll have a little bit more insight and can provide some of that information to you. So look for that information, keep tuned in, and I will see all of you next week at Weekly Webinar Wednesday.
Thanks, Liz. Appreciate the opportunity. And everybody stay safe. We'll see you, after the lockdown ends. So
we'll wave at you all through the windows.
yes. All right. Bye-bye.
Goodbye, everyone.